2, 1.
Thank you, Sierra. Welcome, Douglas County citizens, and thank you for joining us for Chairman Dr. Romona Jackson-Jones's virtual town hall COVID-19 update. I am Dr. Michelle Allen, the Intergovernmental Affairs Manager for Douglas County and tonight's moderator. Joining us tonight is Dr. Janet Niemark and Deputy Director Lisa Crossman from Cobb and Douglas Public Health. Please join me in welcoming Chairman Jones.
Thank you so much, Dr. Allen. I would like to start by, first of all, thanking the citizens of Douglas County for joining my town hall to allow my office to share the latest COVID-19 updates in our community. And also we have a special edition regarding monkeypox. I want to call it everything but monkeypox. I extend deep appreciation and respect to the citizens of this county for your resilience, certainly during the last 2.5 years, while adapting to the mitigating measures to keep us all safe. COVID-19 has affected all of our lives tremendously by taking the lives of our loved ones, incapacitating some of our lives with long-term COVID-19 symptoms, and confirmed in the words of Amanda Gorman, what was will never be again. Certainly, I would like to thank Cobb and Douglas Public Health officials, Dr. Janet Niemark and our Deputy Director, Lisa Crossman, for taking the time to speak with the citizens tonight about the latest sub-Omicron twin variants, BA4 and BA5, with an underscore of updates as we continue to gain some sort of normalcy despite our circumstances. Unfortunately, Douglas County is among the counties in the state of Georgia in high status. And certainly this is a great time that I thought a town hall would be suitable for the citizens of Douglas County. It's been a while since I've approached you. I tried to not just keep bugging you. I probably was one of the leaders in the state of Georgia that just kept making sure that we were on point and on message. And here I am again, because this variant and this virus is determined to win, but we will win because we will continue to do the 3 W's. We will continue to go with washing our hands repeatedly throughout the day. We will certainly watch our social distancing, and we are now wearing masks again in the courthouse. So with no further ado, Dr. Allen, I yield back to you, and I look forward to our citizens of Douglas County certainly embracing and endorsing the information that's being shared tonight as we continue to remain safe in our county. Dr. Allen, you have the floor.
Thank you. Thank you, Chairman Jones. Next, we will have a presentation from Dr. Janet Niemark.
Thank you so much for having us today. I'm going to go ahead and I'm going to just kind of change things up on you a little bit, and I'm going to give you a kind of a primer on monkeypox today. It is in the news a whole lot, and I know a lot of people have a lot of questions, and so we want to make sure that we get this information out to you all, and then Deputy Crossman will go ahead and give you the COVID update as well. So if we could go ahead and pull up the slides. Great, you can go to the next slide. Okay. Very good, next slide, please. All right, so for those of you that were paying attention this weekend, we heard that monkeypox has officially been declared a public health emergency of international concern by the World Health Organization. And so those of you that have been with us
Questions?
couple of years, you remember maybe when this had happened with COVID as well. And so we've been hearing about monkeypox the last few months, but it is official that it is an international concern at this point. So why don't we go ahead and I'll tell you a little bit about what we know and what's happening with that. Next slide. So the background of monkeypox is that, it's actually been around a while. And so it is caused by a virus called the orthopox virus. It's in this family that causes monkeypox. And, it is a relation also to the smallpox virus as well. And but it's not related to chickenpox. I know that gets confusing at times, but it is in kind of the same genus family, and so there is some similarity, and some of the treatments and things like that will have to overlap during this epidemic that we're seeing. We don't actually know what the cause is, but like I had mentioned, it has been around since 1970, which was the first reported case. We have seen it in animals like monkeys from Africa, and oftentimes when we have seen it pop up in humans, there has been some sort of contact with monkeys or animals in Africa. And so this is where we deviate from the script a little bit, because what we were seeing was we were not seeing this contact with animals or traveling. And that's when it really started getting people's attention, because now it was starting to very effectively spread from human to human. And so before all of that, I talked about how it had gone with traveling and with animal contact. Next slide. Okay, so currently, so it has been kind of gaining speed. We had seen it in the UK and several other countries, and now it has been in the United States for the last few weeks. And it's not 3.5, sorry, it's almost 3,500 cases that we've seen since yesterday in the United States. 268 of those are in Georgia. And I think we were like fourth or fifth in highest number of cases in the country of monkeypox. And I know some of you may ask, does Douglas County have any cases? And actually, we do have a few cases that are in Douglas County as well, of residents in Douglas County. And so it is, it's right now, it's maintained mostly in the metro is where we're seeing the cases, but we are seeing some spread out to other areas as well. Like I said, we're not seeing, it's not travel related anymore or really associated with animals. We are seeing effective human to human contact. And what we're seeing in the data right now is that the number of cases, the most cases by far are pretty much, it seems to be through sexual contact. And it seems to be mostly men who identify as gay, bisexual, or having sex with other men. And that seems to be the highest number of cases that we've seen. We have seen one today that popped up, if you saw the news, in Georgia, our first woman case in Georgia. But there have been 2 children in the United States that have also gotten it as well. And if you might be asking, it's not through just sexual contact. Once you get it, then you can spread it to other people. And that's why this is a concern. And I'm going to tell you how it spreads, but it does not have to be through sex. Once you have those lesions, wherever you have those lesions, you have a possibility of spreading to somebody else. So this is why it's of concern. It may be starting out in one kind of demographic of people, but it can spread. And so we want to make sure that everybody understands. Next slide, please. All right, so usually it is a direct contact. And what I saw a CDC presentation today, it does seem it's the majority of folks, like over 90%, had a rash. And so having that rash, which I'm going to show you later, is very, very effective. If you're very contagious when you have that rash. And so it can be spread that way, or through bodily fluids we're seeing. It can even, be through some contact with like clothing and linen. So bed sheets and things like that. If you have lesions that have been in contact and maybe spread, on bed sheets and things, there's a possibility as well. You can have through respiratory secretion. So it's like prolonged, face-to-face contact. This is not like COVID. And, Lisa's going to talk about a little bit about BA5 later, which is very, very, very contagious through respiratory droplets and contact. This is not as contagious in that manner, but you can if you're in prolonged contact with somebody. And they are showing some transmission from fetus to the fetus through the placenta for pregnant women as well, and from infected animals as well. So there are many ways that this can spread. So you can see sex is on there, but that's not the only way. And this is why we need to make sure we kind of get this as controlled as possible. Now, it can spread from any time from having the original symptoms until the rash is fully healed. And that is basically that I'll show you how it has a pustule, and then it will scab over, and the scab has to fall off, and there has to be new skin underneath. It can be anywhere from 2 to 4 weeks that you are infectious and have to be isolated. Next slide. So here's some of the clinical information. So what people are showing, so the rash was by far one of the highest symptoms that people had been showing. You can have fever, headaches, muscle aches. You can have swollen lymph nodes, chills, and exhaustion. And, it sounds like any other viral illness that you can have, right? The rash, you can see on the right side over there that it has like this curly pustule look to it at first, but then it will scab over. So kind of like the, chicken pox virus, although it's not the same thing, but it's same thing where it will scab over as well. And it will go through different stages of healing. Next slide. So there is testing available. So, like when COVID came around, everything is kind of being ramped up right now. And so the federal plan for this is, where they're starting with the federal and state public health departments that are starting with the testing, but now immediately it has gone out to commercial centers as well. So physicians will, should be, pretty much now should be able to order having a monkeypox test done on the lesions if you had it, and it has to be kind of the lesions they have to kind of rub on to be able to send it off. So it's available commercially. Your physician or urgent cares or emergency rooms should know about it. Make sure you call them ahead and let them know that that's what you're concerned about. You can go to public health, which will talk you through it, and then if we need to test you, we can do that as well. And we're ramping that up as well more in our health department. But if you think that you have a case, if you had some sort of contact with somebody that might have had or has had a case, please isolate yourself once you have those symptoms, because what we're hearing is that people, they have to be isolated, and they're not isolating away from their family members. So they're still playing with their kids or hanging out with family, and that gives your family a much higher chance of getting it if you have it. So please remember, when you isolate, that means it's not just staying home. It means you got to isolate and kind of have your own room, own laundry, own, all that kind of stuff away from your family members and your pets too. Next slide. So for the follow-up, isolation can be anywhere to 2 to 4 weeks right now, because the scabs and the rash have to scab on over. There is a treatment, an antiviral treatment called TPOXX. It's available, but it's a little bit difficult to get right now. It is only approved for people that are at risk for severe disease, and maybe are hospitalized or something like that. And it's not an FDA approval. It's only an investigational drug approval, and it has to go through the CDC to be approved. And so it's not readily available right now. Now, there are vaccines, and you're going to hear about this come out more and more. The federal government has started off with different phases, and they didn't have that many vaccines available. And they are finishing phase 2, and we'll go to phase 3 soon, with more and more vaccines should be available. So there are 2 different vaccines that are available. I'm going to only tell you about the one right now that we're all working with, and that's the Genios Vaccine. Now, right now, that vaccine, there are 2 different reasons that it is being given. One is if you have been exposed to somebody with monkeypox, and you are a close contact, you can get the vaccine to prevent you getting getting monkeypox within 4 days. You got to try to get it. If you get it after 4 days, between 4 and 15, it can help with your symptoms. So that's what is coming out. If you are interested, please continue to visit our website. We have a small events that will be coming out, but we are integrating it into our health department so that people will be able to get it if they are in the high risk category. That's the second group that is going to be getting the monkeypox vaccine, is those that are higher risk. And so right now, that group, because we don't have much vaccine, has been identified as those people that identify as having sex with other men, or who have and have a history of sexual contact. So with 2 or more partners within 14 days. So you kind of have to have both of those to fall into this category right now. But it will change as we get more and more vaccines. But right now, they're prioritizing. They're almost exclusively seeing the virus being spread amongst this population. That's why we're trying to vaccinate this population, so that we can get that under control, and then we will spread out to more and more folks. One of the questions I think is going to come up is, why is this happening now? Why all of a sudden, and that's a great question, right? And so, there is some thought that, after a while, if you can, continue to have viruses that continue to kind of propagate and, travel between humans and hosts, and, just like we've seen in COVID, how many mutations are we on now, right? Well, other viruses mutate as well. And so eventually they may get really good at hopping onto a human and be able to spread from human to human, right? And I think this one is showing that it is able to do that. Another thought is that, we may have waning immunity to the smallpox vaccine. So a lot of folks that were, born before the 70s have probably got the smallpox vaccine. And so, but they stopped that in the 70s. And so we have a whole group of people, myself included, that never received the smallpox vaccine. So we've got a lot of people that have no immunity. The drugs and vaccines that we've talked about, they're kind of they've been made for smallpox originally. And so, if we had some protection from the smallpox vaccine, now, we may just not have as much immunity, and that's why it's giving even more opportunity for monkeypox to take advantage. Next slide. I'm not sure, and I think that's it for that. So I'll be able to answer questions later when we're done.
Thank you,
Dr.
Dr.
Allen,
Mead.
do you want to cover questions for monkeypox now, or do you want to wait?
I can wait for a little bit.
Okay.
Okay, thank you very much. Thank you, Mr. Memark. That was very, very insightful. Also, we'll have the time where we'll all have the questions for the COVID and monkeypox at the same time. So that'll be great. Next, please join me. We have you next, Ms. Crossman.
Great. Could you all share the slides again and go through to the COVID section, please? Thank you so much for having us again tonight. I know that we haven't talked in a while about COVID. I'm sorry to be coming back to you and talking about this again. I know that we are all fatigued about COVID, but it hasn't gotten tired of us. So let's go to the next slide. I just want to give you an update and kind of some guidance going forward. So unfortunately, Douglas County is back in high transmission. Recall that this transmission category is determined by the number of cases that we're seeing in the population, and also the number of new hospitalizations with COVID. So we're back in the high transmission. Also, I want to make sure that you all understand that the number of new cases is really determined just by the PCR lab testing. So we know that the number of cases we're seeing in the community are much underreported because of the number of home rapid tests that we're all using. So we know that the number of positive cases in the community is even higher than what we're reporting here. And I just want you to keep that in mind. This information is available to all our residents online, and it's updated every Thursday with new information. All right, next slide. This is, you all have seen this before if you've joined any of our Zooms. This is off of our Georgia Department of Public Health website. And I just want to call your attention to the section at the far right where you start to see that yellow line start to increase up after about the first week or so of April. So this is the total number of cases in Douglas County based on their date of onset, and we've seen since about the first week of April kind of a steady increase in the number of cases in the county. All right, next slide. We are also unfortunately seeing that the hospitalizations in Georgia are increasing. If you look at the small chart, kind of in the middle of the slide where the black dotted lines are, you can see there toward the end of that chart, that uptick again, that's the number of hospitalizations that we've been seeing in the state. And then if you look over at the multicolored graph on the right-hand side, that's divided out by ages. And so these are the number of hospitalizations that are going up by age. And you can see this burgundy line that has peaked each time that we've had a surge. That's our over 70 group. And so you can see again that the hospitalizations that we're seeing, although they're going up slightly for almost all age groups, they're dramatically going up for our over 70 residents. And so that's another reason why we're really encouraging our senior population to make sure that they've gotten their booster if they haven't so far. All right, next slide. You mentioned, Dr. Memark, about the BA5, and I think Dr. Jackson Jones, you mentioned this as well. This is a chart that shows over time which variants we're seeing in our Southeast U.S. region. So remember back in April, we were really talking about the Omicron BA2. That's that pink bar that you see here. But then that soon was overtaken by a different Omicron variant. And then now what we're seeing is this BA5 that reflects about 75% of all the cases that we're seeing are this BA5 Omicron variant. And as Dr. Memark mentioned, it's shown to be very, very contagious. And so we just wanted to bring that to everyone's attention. Dr. Memark, anything particular you want to say about BA5?
No, with BA5, we know that it's the most contagious of all of the variants that we've seen thus far. And I think what's interesting about this graph, for those of you that were with us originally, the graph was made up of completely different colors, and now because it's now indicating that we've been overcome by different variants that so we don't even have the originals on there anymore. And so BA5 is very, very contagious. It's not showing to be more severe in symptoms, and so that is definitely a good thing. But it is really is quite clever of a mutation or it has 50 mutations, but very clever. It's been able to evade our immune system as well as a lot of the vaccines, and so. What we're seeing is that people are reporting they're being reinfected even after they had gotten Omicron originally, or being reinfected with BA5. And you might have gotten the vaccine, and you may get BA5. Now, the good thing I think Lisa's going to show you a little bit later is that the vaccine is still extremely effective against hospitalizations and death. And that is really one of the most important things. And I have seen it in real life too. Those that had received the vaccine, a good timing on the vaccine, seem to have gotten better protection than those that did not get it in the last 6 months or so.
Great cue, Dr. Memark. If you'll go to the next slide, you'll see what she's talking about. So this is, if you'll look at, first of all, the top graph, what you're seeing is the gray, kind of the medium gray line down at the bottom are folks who are fully vaccinated and have had their boosters. The red line are people who have just had their primary series of vaccine. And then the dark black line that you see at the top are folks who are unvaccinated or only partially vaccinated. So you can see when we've had each surge, remember the surge that we had back last fall and the one we had in the winter at the beginning of 2022, we've seen that those have peaked particularly with folks who are unvaccinated or undervaccinated. If you look over in the July 04, so that was that first week in July, you can start to see how the unvaccinated or partially vaccinated hospitalizations start to go up again, are starting to go up again, compared to the other folks who were either had their primary series of vaccinations or had their primary series plus a booster. So that's why we're encouraging folks to get boosted, get vaccinated. This is the time if folks were waiting. And then if you look at the bottom chart, this is related to the number of deaths based on that same vaccination breakdown. So you can see the number of deaths down at the very bottom of the chart in the gray dots, the number of red deaths due to folks who didn't have a booster but had their primary series. And then the black line is folks who are unvaccinated or undervaccinated. We're still seeing our deaths be very low from this new variant, which is great news. I hope that continues, but we just want to make sure to encourage folks to not wait if they need their booster. All right, next slide. Let's talk a second about the access to testing and vaccinations if you're interested and need that. Next slide. So we are still, Cobb and Douglas Public Health and some of our lab partners are still providing free PCR drive-through testing. We have had a change this past week. You know that for the last year and a half, we had been providing testing at Arbor Place Mall. We have closed that location as of last week, and we've moved that testing over to our Douglas Public Health Center parking lot. So we're doing drive-through testing at the Douglas Public Health Center. We continue to also offer folks testing at the Riverside Epicenter right off of I-20 and Riverside Parkway. And then for folks who may be in and out or working in Cobb or something, we do have a location over at the East Cobb at the Health Park, Wellstar Health Park. These are still free. We do ask that you pre-register in advance, but literally it's taking less than 10 minutes to go through the drive-through, and results are coming back in about 24 hours. All right, next slide. I also want to encourage folks, if you haven't gotten a supply of home test, antigen test kits, that we have those available for you, also free of charge. You can visit our Douglas Public Health Center or any of our other public health centers and pick up one of those kits free. And just a reminder, I think we've talked about this before, but the federal government is still offering those free test kits. It literally takes about 30 seconds to register to get those test kits. You can get 8 per household, and you go online to covidtest.gov, fill in your home information. You don't have to put a credit card. You don't have to put any insurance information, and those kits are coming in about a week to 2 weeks to your home. So I encourage folks to have those available just in case you're seeing symptoms or someone notifies you that you were a direct contact. That way you can have those available to you. Next slide. So let's look at vaccinations. So right now in Georgia, we can see that our residents are about 57% are fully vaccinated. You know, that kind of held steady right after the first of the year. We do have about 43% that have gotten their additional dose, but we're not fully vaccinated yet. And compared to the rest of the U.S. that has about 83% of the population vaccinated, you know, we're still lagging a little bit behind. All right, next slide. When we look particularly in Douglas County, we're at 52% of our residents are fully vaccinated right now. Again, that's kind of held steady and flattened out a bit after this past year when we saw that big increase. So we need to make sure to encourage folks that if they haven't gotten vaccinated, that's still a good time to do that. If they haven't gotten their booster, this is a really good time to do that. Next slide. So who's eligible? Anybody now 6 months or older. Remember, we've gone through different phases where different age groups are eligible. Our most recent is that we have 6 months and older that can now get vaccinated, and that everyone 5 years and older can get their booster shot. So again, I just can't encourage this enough. We've got it available. There's no wait, there's no shortage, and folks can go not only to public health, but to their pediatricians and to their pharmacists. I do want to point out that most pharmacies are not able to provide vaccinations to anyone under 3 years old. So if you're wanting to get a young child vaccinated, you'll need to do that through public health or through your pediatrician. Dr. Memark, anything you want to add about this piece?
Yeah, the only thing I wanted to add was the FDA has recently approved, and ACIP has accepted a new vaccine that's coming out, the Vac Vaccine. That is another COVID vaccine that is coming onto the market. And this one actually is one that's been developed in the more traditional methods of vaccine development. For those of you that were concerned about the mRNA vaccine that is Pfizer and Moderna. And so this one is coming out soon. You may see different offices offer that. We are getting ready to offer it in small amounts. We want to see how many people are interested in it at our centers. So just keep on the lookout, and you can contact us or keep checking our website if you're interested in the Novavax vaccine.
Thank you. I've put information in here. These links are active, and you all are welcome to make this available on the Douglas County website. But this will give you information about what do I need to get vaccinated and who's eligible. and when am I eligible for a booster? These two links make it really easy to figure out what you need. All right, next slide. So basically, because we are in high spread, these are the basic recommendations right now. One, as I've said about 6 times on this Zoom, to stay current with your vaccinations and boosters. That's the best tool that we have to protect yourself and your family. If you go indoors in the public and you're particularly in crowded areas, wear a well-fitting mask. If you can, also maintain 6 feet of distance with those people who are outside your home when you are indoors, if possible. Can't emphasize it enough to wash your hands often and use hand sanitizer if soap and water are not available. Continue to do cleaning of high-touch areas. Avoid really tight, poorly ventilated areas with indoor crowds. We're seeing that that's a way that people are getting infected. And then I really encourage you that if you are exposed, if somebody notifies you that you've been a direct contact of theirs, or if you have even mild symptoms, I can't tell you the number of people who are saying, oh, I thought it was just a summer cold, or I just thought it was my allergies acting up and my nose was running. Please just use one of those rapid tests or come through our drive-throughs for a PCR test, because we want to make sure that you know what you have. And more often than I'd like to hear, it's been COVID in the last several weeks. I've included a link here for a COVID tool. CDC has a great quarantine and isolation calculator that is just spectacular. It asks about 5 or 6 questions based on your vaccination status, who you've been exposed to, when you were exposed, and it easily calculates for you what you should do next in order to be safe and to keep your family members and coworkers safe. So I encourage you to link on the website to look at that quarantine and isolation calculator. It's a great tool for everybody. All right, thank you so much. And Dr. Allen will be happy to entertain some questions.
Yes, ma'am. I have the first question. We're going to start with COVID. If a person has been infected before, and does it make it easier for them to get COVID again later?
I think it's maybe the opposite of that, right?
Right.
If you've been infected, usually what we would say is that if you've been infected, you're usually considered safe for 90 days after you had an infection. Now, here's the difference that we're seeing this time with this variant. Previously, we had seen some people have some pretty good immunity, like lasting immunity. A year was not uncommon, right? But with this variant, we're not seeing that. We are seeing people that have been infected not too long ago, within the last few months, and then get infected again. And so this is a little bit different variation of it. So I just want to make sure everybody understood. So you don't have a lot of lasting immunity if you had gotten it earlier in the year.
Right. And the next question is, what is high transmission?
So high transmission, again, if you go on the CDC website, high transmission is considered more than 200 cases per 100,000 of the population, plus a certain percentage of your COVID hospital beds being taken up with folks who have COVID. And so they put kind of those numbers together in a formula, and that's how they get the high transmission.
And in terms of on hospitalizations, I don't think we touched upon it for locally, but we had seen a large number of hospitalizations back in the wintertime due to COVID. And what we're seeing now is that we are seeing a little bit of a jump right now, but it's not quite at what we had seen previously. And it's probably due to all the vaccines and infections that we had. But I would say about 25% of what we had seen. And so we've been very lucky. I think just the timing has kind of worked out for us. So hospitals are seeing increases, but they're not overwhelming like we had seen back in the wintertime.
Okay. I think that's a kind of line with the next question. Was they wanted to know if COVID has like seasonal times. Like we always think of colds in the winter, no certain time.
No.
We
Now,
wish it were seasonal.
yeah, I think that the only thing, so I don't think there's a protective effect necessarily. We saw our big Delta wave last summer, and then now we're kind of dealing with this wave as well. I think wintertime makes it worse because we're indoors more. I think, and we're, breathing the same air and with each other. I think it just, that makes it worse. But we don't see any kind of protective effect like, oh, sunshine makes it go away. We're not seeing that.
Yeah, we remember that.
Which would be nice.
I know, right? Then everybody will be good.
Yeah.
The next question was if they test positive, they've never been vaccinated, and I think you've already touched on this. They test positive and they've never been vaccinated. What do they do next?
So again, I encourage the folks, if they've tested positive, to use that CDC quarantine and isolation calculator that will tell them specifically based on when they started seeing symptoms or when they tested positive, how long they should isolate. Generally, your isolation when you're positive is 10 days. That's the safest bet. There is some leeway for folks if they will isolate for at least 5 days and then have some very protective habits for the next 5 days, meaning I wear my mask 100% of the time. I really watch my distance with people. Then you can get out and about a bit for the other 5 days. But if you're really trying to be the safest, I'd say the isolation needs to be for 10 days.
And remember, you cannot have a fever to go to the 5 days. So no fever for 24 hours. And I'm going to add on to that. I see a lot of people think they're free after 5 days, which, maybe legally you are. But, if you're really sick, don't go out and about and hanging out with everybody. So, even if you are at that 5 days, I have seen a lot of folks that have been pretty sick. Don't be coughing and, all over folks and stuff like that. Just let's use some common sense. If you're sick, don't be around folks until you are feeling considerably better.
I think that 5 days point is when they start feeling a little better and they're like, okay, I'm good. I can do things I've done before, but they're still have some infection, right?
Mm-hmm.
Yeah, and that's like the bare minimum that but you should be feeling considerably better, fever free, and putting those protective measures in place if you're going to be out and about. But if you're really sick, I've seen some folks get pretty sick with this. So if you're pretty sick, please don't at 5 days even don't wait until you're considerably better.
And the last COVID question is, what are the medications that they are given once they're infected?
You want to take that back to me, Mark?
Yeah, so there's a couple of medications, including Paxlovid that is available to folks. But there's a couple of recommendations, and I think that Lisa, we can add this on. And this is an important point for those of you that are higher risk. Even though the severity is not as bad for this one, remember with our waning immunity, you still have a risk of getting sick, and even if you don't get hospitalized or die or anything, nobody wants to be severely sick, right? And you don't want to have, get a secondary bacterial infection and pneumonia and things like that. And so when you go to I think the CDC has a website, but we can post it as well. Actually, it is on our website. There are these test to treat locations where you can actually go. If you don't have insurance, you can go and they can test you. And if you are positive and are higher risk, they can prescribe you the medicine right there to be treated, or you can call your doctor. The doctors have been much, much better about getting people prescriptions now and things like that. So you can do that, and it will definitely help with your severity and decrease risk of hospitalization and death. And so please, if you have, if you're older or you have any significant medical problems and you get sick, please consider getting treatment because that should help you a whole lot.
Okay. Thank you. So now we move on to monkeypox. The first question was, is there blood testing in addition to the lesions or rashes?
Yeah, right now we don't have blood testing available. Right now it's the lesions. It seems to be kind of the scabs and blister lesions that are being tested and doing multiple sites that are being done at this point. So right now we are doing, it's a PCR testing for the lesions.
Okay. So how would they identify someone that has monkeypox? How does that rash differ from just a regular rash that they would have?
So this is a great question. So And I think this is where it's going to be a little bit difficult. You know, probably it's going to be tough with just the rash to be able to make the diagnosis with that. So, if it looks like that and, it's been identified as painful too, then, you can definitely speak to your physician. But mainly the main thing here is going to be the contact or, have you had the risk that could put you at risk for getting monkeypox? So, have you had sexual contact with somebody that had a rash? That is one of the main things that we're seeing with this. If that happened to you and then you develop a rash, then there might be a good chance that what you're seeing is monkeypox. Have you had contact with somebody that had monkeypox or had a rash? And maybe not everybody will tell you, right? But if you were hanging out with somebody and you're like, oh man, I noticed that they had this rash on their arms or legs, and we were hanging out, and then, lo and behold, a week later, I'm developing this painful rash and fevers and things like that. So maybe that, something like that. But I think it's gonna be hard just to look at the rash and say, oh, that's monkeypox, but, having a little additional story with it might help you. And hopefully we'll keep it at bay and so that it doesn't get widespread.
Another question for COVID. I know I said we were switching, but I have another question. Okay, so they've had 2 boosters. When should they get another one?
I think that's where we're at right now is the 2 boosters.
Right. So we have the 2 boosters. Dr. Memark, it seems like if you were immunocompromised, there was an opportunity for a 3rd booster, I think, but not for people who were just the general population.
And just so that it won't be confusing, that was actually called the additional dose, and then you get the 2 boosters. So those of you that are immunocompromised, you would have gotten the additional dose plus the 2 boosters. They are talking about, so it only starts at age 50 or immunocompromised right now for that 2nd booster. So people like me have not been eligible for the 2nd booster. They are talking about possibly opening that up a little bit, and then we'll see what else. I know there was some discussion of targeting BA4 and 5 and getting another vaccine or something like that. But I hopefully this will become more like the flu, where they'll try to match it up together, and we will get the shot as necessary.
Okay. Next question. I'm still having COVID symptoms, such as coughing and fatigue 4 weeks after testing, but I'm not testing positive. Should I see a doctor?
Yeah, so, as a physician, if I am hearing that, sometimes those coughs, like the bronchitis coughs, can take a while to go away. Unfortunately, we are seeing a lot of folks that are developing the long COVID symptoms as well, which, they can develop this fatigue for a long time and brain fog and the breathing troubles as well. And so I would suggest, if it seems like it's getting better slowly, maybe you're okay. But if it seems like it's not getting better after a prolonged period of time, or if it gets worse, I definitely would go to the physician, because you could have something else going on as well. And so 4 weeks does seem like quite a while. So I would probably talk to your physician to make sure that you don't have anything else going on.
Okay, it sounds like it's lingering, so they may need some additional help.
You might, or you got something else. It could be,
And the last question is, when will all age groups have access to the vaccine? I know we're like 6 months and above, right?
Right. So currently, individuals 6 months and above have access to that vaccine, to the COVID vaccine. So I haven't heard that we'd be going below 6 months at this point.
No, I haven't heard that either. So,
and that's not unusual. There are many of the childhood vaccines that you want to wait till the baby gets a little bit older before you give them the vaccine. So I'm comfortable with 6 months. I haven't heard that there's any push to try to get it below 6 months.
No, I'm not hearing about any studies or anything that are being done right now under 6 months. No.
All right, that was our last question. So, Dr. Memark, last words, last bit of advice.
Yeah, so, I feel like we're kind of old pros at this now, right? And so thank God, our community, it's not as bad as we've seen, just in the last year, this wave. But we should know what to do at this point, right? And so, they don't last forever. So, when these waves happen, we have to just make sure that, we're boosted up, vaccinated up, and make sure you protect those folks in your family and friends that they're most vulnerable. And so making sure that you just don't you don't get them sick and masked up when you see them and things like that. As we deal with monkeypox, please keep checking back with us. We really try to share as much information as we possibly can with everybody. It's right now it's in a certain population, and we really want to make sure it just doesn't just keep spreading and spreading and spreading. I don't think it's going to be like COVID, but we definitely don't want it to get too out of control. And so please keep checking back with us, and we'll try to get everybody vaccinated and as soon as the vaccines come to us. So thank you, everybody. I know this has been a hard couple years, but Douglas County has been wonderful in trying to keep up with everything, and we appreciate Dr. Jackson Jones. You've been on the forefront of and awarded this year by the Georgia Public Health Association for your leadership on this, and so we really appreciate you, and thank you.
Thank you. Ms. Crossman, Deputy Crossman, what words of advice do you have for us?
So I'm kind of a primary prevention person. And I would say, first of all, as much as you can related to COVID, follow those guidelines that we know to follow. If I'm going to be in a really crowded indoor area, I'm going to want to mask up, right? And all day, I'm going to wash my hands as much as I can and use hand sanitizer. And I really do encourage folks to strongly evaluate the COVID vaccines. Oh, I think I'm muted again. Is it okay? Can you hear me? That you consider the vaccinations and boosters, particularly if you're a senior adult, because that's who we're seeing get hospitalized right now. Related to monkeypox, I would say again, I'm a primary prevention kind of person, right? So if I am interacting with folks, if I know they have blisters on their skin, I'm not going to have skin-to-skin contact with them. I'm going to ask people about that. I'm going to be really conscientious if I develop unexplained blisters on my skin, that I'm going to go immediately and get that tested so that I don't put other people at risk. So I just really I encourage folks to do the primary prevention efforts that we encourage, and then to take the self-responsibility that if they are experiencing symptoms of either COVID or monkeypox, right, that you go get tested so that you know and you don't spread those to other folks.
Okay, thank you. What about a phone number or email that our citizens can contact the center if they have additional questions that we didn't answer tonight?
So our CobbinDouglasPublicHealth.org website is a great resource for a lot of additional information. It also on that website has a contact you, right? Contact us kind of thing where you can put your questions in there and we'll answer those back. We also have a call center, 770-514-2300, that folks can call if they need more information.
All right, well, let me tell you, this was very informative for me. And thank you for, sitting here and answering these questions for our citizens. And you've given us your last words. Anything else you can think of that you like, darn, I should have said that you can let go of? No?
Thank you. Truly, thank you to the residents. Thank you guys for making the platform for us to be able to get this information out. But really, thank you to the Douglas County residents who are doing their very best to keep themselves healthy, to help keep their colleagues and the other residents healthy as well.
Dr. Jones, I'm sending it over to you. We can't hear you.
I'm on mute. Sorry about that. Thank you so much, Dr. Allen, and also thank you, Dr. Niemark and our Deputy Director Crossman. Certainly, before I close, yield some closing remarks, had a question regarding timing of the booster vaccine. 2 booster vaccines are required. at any rate, if you develop COVID-19 after you receive your first booster, how long should you wait before you receive your second booster? Can you give us an idea? Is it after that 6-month period? I believe it's 6 months after you received your first booster, you need your second booster. But you develop COVID-19 on that 6th month. What happens?
So I'm going to be honest with you on what I've been telling folks about this. It seems to be that there seems to be some timing on this that's kind of important for your booster shot. So if you have gotten your second booster like 9 months, a year ago, you might not have as great a protection that if you had gotten it a month ago, right, during this current surge. And so, first of all, you would have to wait 90 days from your infection to get the vaccine, right? So you can time that out with the first and second booster and all that kind of stuff. But, if like you're due now, this would probably be a great time while this is all happening, right, to get some protection for yourself. But let's say, we hit like this lull and the cases go back down, we pray, like go back down to nothing. I would probably wait a little bit, right, until we get if another variant or something comes along, so that you can get the next booster. You know what I mean? And so, if nothing is happening, I'm not sure unless you are an older individual or you have medical problems, you just want to make sure just in case anything comes along that you can do that. But if you're kind of healthy like I am, I'd probably wait just a little bit until you see it happen. You see some of these the cases start ticking up a little bit, and then I would probably do it. But you're safe to get it whenever it is during the window. You're fine to get it, so it doesn't hurt you to get it. But I try to time it a little bit as best I can. So.
And Dr. Jackson-Jones, remember it takes a week, maybe 2 weeks to fully develop your immunity after your shot. A little less time for the boosters, right? But so you might also consider timing it if you're going to be traveling and in indoor spaces. For example, let's say you have concert tickets to an inside concert venue, and you just do not want to pass that up. I would make sure to time your booster a week or two before that concert to really have your maximum immunity. Or if you're traveling internationally, we've had a lot of folks who have been traveling this summer, and so they timed it so that they had their booster a week or two before they traveled.
And adding to what Lisa just said, we have seen an incredible number of people come back with COVID after traveling that did not get their boosters. And so that it works both ways. So we are seeing a lot of people being infected this summer after travel.
Okay. I try to capture the thoughts of our citizens who may have questions, and I'm just trying to think along those lines to certainly try to see what type of information I could pull out of our panel here. I have one other question regarding monkeypox. You mentioned smallpox. There was a certain window of time when it was required in the United States. I believe it was around in the 70s. So with that group who has received the smallpox vaccination, they're not exempt, correct? They still can
yes,
develop monkeypox.
That's a great question. Because we don't know exactly how long that immunity lasts. In that presentation from the CDC today, I saw someone that was almost 80 years old that had monkeypox. And so I'm assuming they had gotten the smallpox vaccine, but I can't be for sure. But yeah, we do not know how long that immunity lasts. So it is the assumption, and remember, it's not the exact same virus either. So we are under the assumption that you can also be infected. So.
Yes, that's a good question for those who thinking, within that window in the 70s, 60s, and 50s.
Great
not
question.
Exempt.
We're not exempt.
Okay, thank you. Well, thank you all so much. I would like to personally thank you, Dr. Niemark, and also our Deputy Director for coming in this evening and spending time with the Douglas County citizens, imparting information regarding monkeypox, which was a total surprise for us, and also COVID-19, which is the BA5 variant, subvariant to the Omicron. Well, we can all the very medical geniuses when this is over with. Who would ever thought two viruses during this time back to back? And certainly I know there's probably more brewing as we speak. So I would like to thank you, Dr. Memark and Lisa Crossman, for all the things that you've done for Douglas County. You've kept us engaged, you protected us, you made sure we understood what was going on, and you have just been relentless in making sure that Douglas County knows about the 3Ws and also about pushing out vaccines and the importance of these vaccines. So we thank you from the bottom of our hearts, myself and the Board of Commissioners, and also the citizens of this county. We have not taken what you have done lightly. Again, we have been together 2.5 years joined at the hip, and I just don't know how much longer it will be. But I must say that I couldn't think of a better team that I would want to be amongst during this pandemic. Of course, you all have been very cool, calm, collective, and you delivered with pristine knowledge, skill set, and it's been very impressive. We just need to listen, and citizens, I hope you hear me loud and clear. We want to continue to listen and just value what our public health officials are bringing to us as we continue to protect ourselves and our family. Dr. Michelle Allen, I would like to thank you for being the moderator today, and I really appreciate you. And certainly, I would just say this has been beneficial to our citizens, and it is now 7:26, and I promised the citizens that I wouldn't hold them long. So certainly, I would love to, with our closing remarks, make sure that we go to, as we mentioned earlier, for the COVID test for the post office. I believe we go to, is it the post office, Lisa? www.covidtesting.gov.
If you go to COVID tests, plural, covidtest.gov, and it should come right up if you Google it or if you put it in your browser. It'll come up with the .gov is what you want to make sure, and it goes through the United States Post Office. You literally just put in your name, your address, and say, yes, I want some kits, and they're shipped off to you.
All right. Well, citizens of Douglas County, there you have it. So please, we encourage you to order. There are at least 8 more tests coming in from the post office. And I just ordered my 8 about a week ago, have those on standby. So in the event symptoms do occur, we are ready to go. So with no further ado, again, I would like to thank our panel tonight, Dr. Memark and Deputy Director Lisa Crossman. And we appreciate everything you do for Douglas County. And again, citizens, stay tuned. This is not the last of me you'll see regarding this pandemic. And now we have a new subject matter, monkeypox. So thank you, citizens of Douglas County. Take care, stay safe, and we'll see you in the very near future. Thank you for joining my town hall tonight. Again, I'm Dr. Romona Jackson-Jones, the chairwoman of the Douglas County Board of Commissioners.
Thank you.